welcome back to Focus Atlanta. Thank you so much for continuing to watch. Again, I am your host, Kecia Gaither. I appreciate you sticking with us, and we have changed the focus on you just a little bit. I'm going to talk about maternal health. I am here with Dr. Kecia Gaither, and we're going to talk a little bit about pandemic pregnancies. Dr. Gaither, thank you for coming on the show.
Thank you, Ms. Lancelin, for inviting me.
Now, I gotta tell you, we had to all kind of know there was going to be a bit of a pregnancy boom with us being locked up in the house with our spouses and with our significant others.
Very much so.
How has it impacted this type of boom?
Well, I mean, everybody is stuck in the house. You can't go anywhere. So there you go. And I'm living it right now. It's very busy.
I'm sure. Are there particular things? I'm sure expectant moms are pretty scared, though, with the COVID being, still out and rampant, everybody needing to be especially safe. Are there any precautions, any things that they could do in terms of continuing to make sure that they're having a healthy pregnancy during this time?
Sure. Certainly, you need to go see your doctor. Please know that every physician's office across the United States has made, certain safety precautions to ensure that there are not a lot of people in the waiting room. Everybody's wearing their PPE, and the manner in which they conduct labor and delivery and postpartum care, all is done to help keep patients safe. So, don't worry about that. Continue to wear your mask. Continue to socially distant. The other thing is, the vaccine is out now. So ACOG, that's the American College of OB-GYN, strongly, advises women to take the vaccine. And I definitely advise you to take the vaccine. There are certain things that happens in pregnancy which depresses your immune system. The fact that you're pregnant, your body is very smart, depresses the immune system so the fetus can grow. The fetus is seen as a foreign object, so the body depresses the immune system so the baby can grow. So that's the first thing, your immune system is depressed. Secondly, as that uterus is growing, it's compressing against your lungs, and so your lung function is diminished in pregnancy. So those are two things which, in the presence of COVID, COVID likes depressed immune systems. So you are a target with that. The other thing that I would recommend, particularly for melanated pregnant women, is to have your vitamin D levels assessed, okay? Vitamin D is a vitamin that's made in the skin in conjunction with sunlight. For people that are melanated, that melanin inhibits adequate production. So just by virtue of the fact that you have melanin, decreases your vitamin D levels in your body. Vitamin D is very important for bones, for you as well as your baby. It's important for mental health, cardiovascular health, immune function. Okay, and vitamin D, in addition, has been correlated with preterm birth if you are deficient in it. So vitamin D is, I usually advise my patients to take 1,000 to 2,000 units a day. It's important to know what your levels are. There is a great website called powerofd.org, which can give you a lot of information as to levels, gives you a little calculator to talk about what you need. You can get a kit there, or you can ask your doctor to check your vitamin D levels. It is very important to make sure that your vitamin D levels are high. Vitamin D adequacy has been correlated in a lot of research that has come out with COVID, that if you are in a good level, 40 to 60 nanograms per deciliter, decreases your incidence of having severe outcomes from COVID infection.
Wow, Dr. Gaither, that's amazing information. Not only for our moms, it's amazing information for all women. Can we close out with the Black Maternal Health is it Momnibus?
Momnibus.
What is that?
That is
the Momnibus Act.
Yeah, what that is, a number of legislators have recognized that there is a significant issue going on with Black maternal health. So with that being said, Senator Adams, the main proponent, one of the main proponents, has issued a bill that has 12 points to it, all of which address some of the issues that are involved in poor outcomes among Black women who are pregnant, social determinants of health, whether or not they're incarcerated, adequacy of being able to get transportation to go to your clinic appointment. So there are 12 points in the bill. I know that we are, at a loss for time, but all of these things are very important to address some of the issues that go into seeing the poor outcomes among Black pregnant women in the United States.
We just appreciate your advocacy. We appreciate the information. Obviously, the more we know, when we know better, we do better. When there are things that we can step behind to become advocates ourselves, it makes all of us a little better as a community. So I appreciate your time. Thanks so much for coming on Focus Atlanta.
Thank you for having me. I appreciate it. Be safe out there.
All right, guys, please take the opportunity to visit the website, Power of D, first of all, because we want to know how important that vitamin D is. We've learned how important it is. We want to know what our levels are and what we can do to improve. Take the opportunity to learn a little bit more and stay tuned for more Focus Atlanta here on Atlanta's CW.